Every year, hundreds of thousands of people are accidentally exposed in the work area to body fluids, and some of the times they become infected. The question is, are you covered in the work arena if you become infected? Security needs are the second layer of Maslow's hierarchy of needs. Only physical needs such as food, water, rank higher than safety needs. Safety needs that we all find to be important. We want a safe place to live, a good neighborhood for our children to grow up in, and a safe place to work. If you're injured, you want support for yourself and your family. If you are exposed while at work, how can you prove it? The bottom line is you cannot. If you had broken your leg while at work, that is verifiable evidence. You came to work as a whole working unit and became injured. You broke your leg. People can see that. It's verifiable. But with any virus or bacteria, it is difficult to prove exactly at what point in time you became infected. Even with witnesses to the exposure incident, there will always be questions about whether you were infected before the incident or after the event. And generally, you are going to have to prove that that particular incident is exactly the point in time that you became infected. Less than 5% of those infected in the work area actually get coverage. The professionals that face the highest risk for exposure and possible infections are medical and dental professionals, individuals employed in all areas of law enforcement, and those folks who serve in our military. While there is a great deal of proof of infection within all areas of medicine and dentistry, there is very little documented evidence amongst law enforcement professionals and military folks, even though both groups deal with high incidence of body fluid exposure. Of the latter groups, both protect and serve the general public and deal with high-risk situations. Even if only 100,000 people are exposed to an infectious disease in a year, and only 1% become infected, that still is 1,000 people that will now face the reality of being infected. You need to ask yourself the question, is that number small enough to be ignored? Is that number small if you are one of those who are now infected? There will always be new diseases in our future. If we cannot address this problem now, what will we do then in the future? If the past is any indication, very little. How long did it take those individuals exposed to asbestos or Agent Orange to get their claims covered? The old tried and true statement from the insurance companies or governmental officials that we do not have any documented evidence to prove or disprove this claim is so much BS. Currently, several medical organizations are asking that hospital patients be tested as part of the medical treatment because they know what happens if in fact they do become infected. Patient advocate groups do not want this done because patients have rights. So where does it end? If people in the work environment were actually covered with adequate coverage, would this still be a problem? And the strange thing is that many states claim coverage, but it is not adequate coverage. An example of this is if one state that has adequate coverage shows that they have awarded over 400 claims in a year, and your state has awarded only one. Does that mean your state has sufficient coverage, or is it just simply so much talk? A few years back, the CDC came out with a statement that up to 10% of the people employed within the medical profession were now infected with some type of blood-borne disease, and they were not covered by local state worker compensation laws. Risk has always been a part of life. In every job type, there is risk from some hazard. The truly bad issue with an infectious disease is the possibility of sharing this disease with a family member. A few years back, one state tried to address this issue by allowing members of a family to collect medical compensation for the spouse's infection. Of course, this did not pass because of cost considerations. The number of divorces that occur because a spouse is infected is disturbingly high. Every year, people leave their chosen profession because of this problem. It always seems to be the fact that when someone else is exposed, it is their fault and their problem. But when it happens to themselves, the reality of what just occurred has a lasting and tragic impact, and they shortly leave that profession.